everyone. We are super excited to have two guests with us here today, which is a first for our podcast. But we're talking about a topic that has captivated media because, it can feel really mysterious, something that not a lot of us have contact with or experience with. And so I think that there's this kind of lore around it, but it's a really, really awful disorder that causes a lot of pain to other people. And so we're really lucky to have two experts with us here today. The first is Dr. Marc Feldman. He's a clinical professor of psychiatry at the University of Alabama, and he is the author of Dying to be Ill. And then we have Andrea Dunlop here, who's the author of 3 novels, including most recently, We Came Here to Forget, from Simon and Schuster. And there's a little bit of a clue in the novel as to what our topic is here today, which is Munchausen's disease and Munchausen's by proxy. So, Marc, can you just give us a background, like what is Munchausen's and what is Munchausen's by proxy?
Okay, Munchausen syndrome refers to someone who feigns, exaggerates, or actually self-induces illness in themselves because it gives them some sort of emotional gratification, such as getting attention, sympathy, care, and concern that they feel unable to get in any other way. It involves deception in that they don't reveal that they themselves are the cause of the misinformation or the medical ailment. Munchausen by proxy is when a person does the same thing, and it's almost always the child's mother. She feigns, exaggerates, or induces in her child psychological or physical illness while disclaiming any knowledge of the source of the problem. So as a result, these children can undergo immense numbers of tests, medication trials, and even surgery that they don't really need.
Yeah. So are there different motivations for Munchausen's and Munchausen's by proxy? You said with Munchausen's, there's a need for attention. With Munchausen's by proxy, is it more like a need for emotional closeness or dependency, or is it a similar process?
Really, it can be a stew of motivations, but I think they have in common the fact that someone is after attention and sympathy, nurturance. You can add to that, in the case of Munchausen by proxy, that these mothers like to appear to be the indefatigable, heroic caregivers of a child whose illness is defying diagnosis. So both of them present themselves as very impaired and doing sometimes fantastic work in being assertive about their diagnoses and treatment.
Okay.
It must be tricky to assess because I'm listening to you. There must be people out there who might have an illness or symptoms that tests don't pick up on, or they might have, had some illness before and they might have pain, lingering pain after. So how can you tell if someone, are people always aware that they're, fabricating these symptoms, or is it sometimes where people have some kind of illness or think they do and they're not sure if it's real or not?
Well, what you're thinking of in the latter case is hypochondria, where someone authentically believes that they have some dreaded illness and may present themselves far too often to the doctor and to emergency rooms and offices, hospitals, but they have a sincere belief that they're impaired in some way. Whereas in Munchausen syndrome and Munchausen by proxy, the person knows that they have manufactured or fabricated illness. It's a deliberate, willful behavior. Often there's considerable planning, which tells you that these moms aren't just psychotic. They're able to organize themselves because they appear normal to the rest of the public and develop plans to elude escape even when they're inflicting serious bodily damage to a child.
Have you seen, is there a typical example or typical presentation of this in your practice or research? Have you seen common forms of this, especially if people listening can maybe identify something that they resonate with?
The most common ailment I see is apnea, which is respiratory arrest. Temporary. The mother suffocates the child to the point of unconsciousness, but not to the point of death, though that's a difficult call in some cases, and it does result in a homicide. She then brings the child to the emergency room, saying he's having recurrent episodes where he's not breathing, and that will lead predictably to really massive medical intervention. It's observation of the child. That can be a scary thing, not only for mothers who are authentically concerned about their children, but for the medical staffs as well. There's also bleeding, where the mother might put a drop of her own blood in a urine specimen that supposedly comes from the child, and that will throw off all the tests and make it look like, at the very least, the child has a urinary infection or urinary problem of some sort. Rashes are common, false claims of fever or induced fever, infections by injecting the child with bacteria. It goes on, and I'm amazed at the kind of weird creativity that these mothers bring to bear when they decide that they want to engage in Munchausen by proxy.
It's just wanted to, if I could just add something real quick, because this just popped into my mind when you guys were asking that the feeding issues too, Mark. So a detective that Mark and I are with on this committee with the American Professional Society on the Abuse of Children that's dedicated to Munchausen by proxy, has said that he, I think, has maybe never seen a case that didn't involve a feeding tube at some point. So especially with, really young children, the mother is, almost 100% in charge of the feeding in the beginning. So having failure to thrive issues where the baby's not gaining weight properly, and, they can't figure out why, and they can't figure out why the nutrition isn't being absorbed, or the baby's having reflux issues. And then, of course, in reality, the mother's just not feeding that child.
That's right. That's a great example.
Yeah. So why the consistent picture here? I mean, why the suffocation until unconscious? Why the feeding tube? Is it just to create a scenario where the mother is in charge of the whole of the child's entire life? Like, feeding is such a regular dependent, the child needs to eat 3 times a day. So is it just like, okay, if I can get the feeding tube, then this child is connected to me permanently?
Well, having a feeding tube tends to be the mother's claim to fame, and it may be multiple tubes at the same time. And often they go onto Facebook and post the child with tubes coming out of every orifice. We call it medical porn. These mothers love it, and they love being perceived to be overwhelmed, but somehow heroically moving on with their lives. So I think there's a common core in the search for attention and sympathy, but the precise reasons that a mother might choose disease X versus disease Y is something that we can explore in individual cases. Maybe we'll find an answer, and maybe we won't.
How does it develop? Like, is there a certain
origin
kind
story?
Is there a certain kind of etiology, like childhood environment or comorbid disorder, like a personality disorder, or any kind of, how does someone develop Munchausen's or Munchausen's by proxy?
Well, research is still in its infancy because these mothers don't cooperate with research. For a variety of reasons, one of which could be legal. If they acknowledge what they've done, they may be susceptible to being charged criminally. But there are other reasons. They maintain the deceptions even when they're confronted with incontrovertible evidence. like a videotape of them suffocating the child in the hospital. In terms of comorbidity, personality disorders are almost invariable among the perpetrators. And typically it's the cluster B diagnoses like borderline, narcissistic, histrionic, others like that. And that just means that the mother has never developed healthy ways of getting her needs met. Instead, she uses dangerous behaviors to try to get the emotional resources she feels unable to get through other mechanisms. So we've known for a long time that it would be the rare perpetrator who does not have a personality disorder. And that's true for adult Munchausen syndrome as well.
What is the prevalence in the population? And does it feel as though this is so rare just because there's so much deception involved? I mean, most of us, maybe there are people with Munchausen's or more horrifyingly, Munchausen's by proxy among us that we just have no idea.
I think there are many, many more cases than are ever counted. But as you're pointing out, this is a diagnosis that's bathed in deceit. And so I think we're only recognizing those few cases where the deceptions are so poorly executed or audacious that we're able to determine it's Munchausen by proxy and count it in statistics. In terms of the US, we estimate that there are between 600 and 1,200 new cases each year in the US, but that's based on some British data that's now gotten quite old. I wish I could give you a firm number, but again, because of the nature of the deception, I really can't do that right now.
Have you seen any changes since the pandemic? This is just such an interesting time for health-related mental health disorders. I'm curious if you saw any changes because of COVID-19.
Sometimes people claim to have COVID-19. At other times, they claim that they can't go to the hospital and in a sense are victimized because of the ubiquity of COVID-19 in the hospital. So they can't get proper care, they say, for whatever ailment they have. I just published a paper in which a few different alleged mothers, and I say that because they didn't really have children, claimed that their children were very sick, but that they couldn't access help because of the ubiquity of COVID-19. Again, I've made it clear, we finally discovered that none of those children even existed.
Wow.
It all took place via social media.
That's incredible.
How can you recognize this in your community or in your family member? Andrea, I'm sure you might have some insight here as well, but are there any reliable signs?
Yeah, I think one is when there are persistent or recurrent illnesses and doctors and others can't find a reason for it, or the child fails to respond to treatments that we know really should be effective. If another child in the family has unexplained illnesses or died for reasons that are unclear, I'd be worried about that. The child may appear healthy, and yet the mother is making a claim of failure to thrive and demanding that tubes be inserted. Also, repeated apneic episodes that are only witnessed by the mother, no one else, including during a hospital stay of a few days, is a warning sign.
And just to add from my perspective, I think the biggest missing key piece here across the board, whether you're talking about the general public, people who might see this in their family or their community, as well as professionals who work with children, really on every level, from medical professionals to CPS to the police, the knowledge about Munchausen by proxy and medical child abuse is extremely low. And so I think, first of all, you need to know what you're looking at, and that will help you determine what it is. And also importantly, what it's not. You were talking, Kibby, at the top of the episode about sort of what if people do have, just a illness that's difficult to diagnose and are needing to seek treatment, both either for them or for their child. And I think that it's really important that like knowledge is power on both sides, right? So that'll keep us from falsely suspecting people of doing this. But I think actually what I've come to learn in talking to all kinds of, both professionals who are working on this and, talking to people who've had cases in their family or with their spouse or, or with a friend, is that it's actually not as hard to determine that this is happening as you would think once you know what you're looking at. These behaviors don't happen in a vacuum and they don't come on all of a sudden. Mm-hmm. As Marc was talking about some of those comorbid personality disorders, I'm not sure what the prevalence is. I think it's something like a third, but of, mothers who go on to do this behavior with their children are first doing it in themselves. So, for those people who are close to the offenders, it's not the feeling that something is wrong is deep and persistent and has been around for a long time. They just don't have the name for it. And then beyond that, once they do have the name for it, they have no idea what to do next. And so I think that's really, that missing piece that, we're hoping to fill in, via various measures, but even in, talking to folks like you guys about it. I think once, again, it's not the child that has one curious medical problem. It's that the child has 100. It's that the child has spent more days in the hospital than they've spent out of the hospital for their entire young life. And no one can figure out why. It's these lists of diagnoses that sort of are things that you couldn't necessarily get a lab test for or see on an x-ray. It's again, which is, I think, why you see almost this playbook developing for offenders, why they're using, a lot of the same things. And yet there is a great deal of creativity, and Marc can talk at length about sort of the effects of the internet and being able to find things and sort of spread things on social media, et cetera. But, it's always these things that are sort of possible to induce or fabricate, right? That's not every disease or disorder. So I think once you know what the pattern looks like, you can't unsee it. And so I think knowledge is really power in people understanding what this is and understanding it when they see the signs. And APSAC, the committee that Marc and I are on, have done amazing work putting together some really great guidelines and some really great warning signs that would actually be great to link to if we can in the show notes. But, this is like a bullet pointed list of some top warning signs. But I think really once people understand what this is, they'll be much more empowered to be able to know when it's happening.
So Andrea, you have a sister who you at least suspect has Munchausen's by proxy.
She has been investigated for medical child abuse. That instance severed my relationship with her and has led me to, my interest in, again, sort of following my curiosity about the issue. It's had a big impact on my life and my family, and has, made me really want to become an advocate for survivors and for just, spreading knowledge about it. Awareness.
It's an incredibly brave thing to have, a loved one. I know you've severed ties, but to say, okay, I need to recognize this abuse and try to help other people, maybe at the sacrifice of this relationship. What's your journey been like with this? How did you discover this, or what has this been like for you?
Yeah. So, I want to be really clear about a couple of things. I am not, Marc is an expert and he is a doctor and I am not. I am a sort of become an armchair expert because of my interest in the topic for the reasons that I mentioned. And also want to specify that my sister has not been convicted of anything. So I just want to make that super clear. But, in terms of my experience, it is very hard I think it's very hard for anyone who suspects that this might be happening in their family to wrap their heads around that idea, right? Yeah. And I think, again, knowing what you're seeing, that was a very I certainly remember like the first time that I think the first time I ever heard the term was in The Sixth Sense. I think that was like the only pop culture representation I'd ever seen growing up. Now it's been in the media a lot, right?
Yeah.
I do remember that Misha Barton was the
exactly. The little girl ghost. So, I think that the media representations have certainly been more prevalent as of late. 2 years ago when my book came out, when my novel We Came Here to Forget came out, and that is, inspired by my family's experience, and Munchausen by Proxy is a big part of that book. There was a sort of explosion of all of these different shows, the Act being a huge one on Hulu, and then Sharp Objects, which was on HBO, I think, that featured to varying degrees of accuracy the disorder. So I think that the public awareness is higher now than it was the first time I was sort of confronting this idea, which was about 10 years ago. And I certainly felt for a long time, I would say up until recently, up until my book came out, really, I felt like I was, ours was the only family on earth that had ever had to grapple with this. And now as I've been, again, connecting with other families, I have found that every family feels that way. So there's a tremendous taboo around this idea. I think it is for most people, this particular form of abuse, which on, the severe end of the spectrum, and there is a whole spectrum. I think that's really worth mentioning. I think people really, go to that very horror movie, Gypsy Blanchard, place in their minds. This can encompass a whole range of behaviors. In some cases it is, as Marc said, sometimes the children don't even exist, which is a blessing. But, it also encompasses, moms that might be sort of living a whole fabrication online, but not doing anything to their children, physically. Now, that's not to say that that's not a problematic behavior and isn't causing damage in other ways, but obviously that's not as severe as someone who's poisoning or bleeding their children or suffocating them or that kind of thing. So it does encompass a pretty big range of behaviors. But I think there really is something so disturbing to people, in particular, about a mother doing this to her own children. I think it's really, truly, in many ways, the most horrifying thing that people can imagine. Mm-hmm. And so I think that for anybody whose life has been touched by it, you feel as though you're in a horror movie, horror movies being your only reference for that. And so I think it feels very alienating, and is very difficult to talk to people about. For a long time, I just didn't talk to anybody about it. And it really wasn't until the book came out and I was doing some media on the topic, trying to, again, just raise awareness. And then I connected with Marc, actually, a reporter put us in touch. And then, we've been talking a lot ever since then. And I, kind of moved into doing some more sort of official awareness and advocacy work with the committee. And that has been actually very healing, because it's been very sort of, validating and cathartic to talk to other people who understand what this is and not be having to explain it from scratch. It's very emotionally exhausting to sit down with a friend who's never heard of this and start from scratch and be like, here's what it is, and watch their eyes get wider and wider. And I've had friends burst into tears. I've had, half the time sort of end up comforting that person at the end, halfway through, no, I'm fine. Look, my life is fine. It's, you don't need to worry about me, or, which is not usually what you want when you're sort of trying to talk about something difficult that's happened in your life. So I certainly hope that, people who've been through this on every level, and I want to say, including perpetrators who have been held accountable and who have sought treatment, I think just lifting the taboo will be helpful to everyone involved, because I think that that's really, there's a lot of, I actually am working on a podcast of my own on this topic. And I was interviewing someone whose sister was convicted and served 10 years in prison yesterday. And she talked so much about, and that story was in the media a little bit locally and a little bit nationally as well. And she was talking about just the intense shame her family felt and how they sort of looked at, how could this have happened? How could we have not seen it? Why didn't we do this? Why didn't we do that? Why didn't we do X, Y, Z? And so I think it's just a really big need for more support for everyone from family members to, the doctors who treat the children. Obviously, they go through a lot emotionally. I think we have a tendency in our society to sort of see doctors on a pedestal and think, oh, they're just these like sort of ultimate professionals that have this professional distance. But it's incredibly traumatic for doctors to get pulled into these cases and realize, you can imagine you're a pediatrician, you've dedicated your life to helping children, and you find out that you've been used as a tool to abuse and torture that child. That is incredibly traumatic. It can really affect their careers. These cases have a tendency to sort of turn colleagues on each other, to turn communities and families against each other. The blast zone for these cases is immense. These deceptions go on for years, decades. They pull in all kinds of like well-meaning, teachers, people who are fundraising, the doctors who are treating the children, people from organizations, strangers on social media. I mean, it's just like the web is so massive oftentimes. And so I think we just really need to think about how to support everyone in these cases. And I mean, there's so much work to be done. It's hard to not sort of just like scratch the surface with these comments, but yeah, I mean, I think that certainly sort of bringing it out of the shadows is a good first step.
I love the term you use, blast zone, because we often talk in this whole podcast is talking about how the effects of mental health on the people around us, right? And the relational aspect of mental health. And this one particularly is, it's so relational. It's so connected to this web of people.
I can tell you that, an experience that I think not only people who've been through a case like this, but someone, some people that I found sort of have a shared experience with this are people who've lost a sibling or, family member to something like addiction, where you feel like that person is still alive, but they're not the person that you remember from growing up. And that you have, it was really very cathartic to sit with this gal yesterday who I was talking to and just talk about, we have these memories of this person that we grew up with, that we were close with, that we loved, and sort of watch them slip away into these behaviors. And that is a really profound loss. And it is one that is very difficult to grieve because you don't have any closure. And I think that that's something that really every family member I've talked to has had that experience. And I think that that's something that people can also relate with, because I think that happens with lots of different things. There's a lot of things about these cases that I think are very, can feel very sort of exotic and headline grabby, right? I mean, I think that's why the media gets very obsessed with the details and the sort of all the sort of shock and awe of it, right? But there's these long effects, and the effects that it has on families that are just, that you're trying to pick yourself up and live your life after this happens. And, people really struggle with PTSD, with betrayal trauma. Betrayal trauma wasn't actually a term I'd heard until I was sitting in my first committee meeting with Marc and his colleagues. And that was a really helpful one to me. It's usually used to describe people who are dealing with infidelity, but I think it's also just a really good term for what you're dealing with when you realize that you've been lied to. I mean, when you've been lied to in a really deep and ongoing way about something really serious. So I think that that's something that people deal with. And actually doctors really deal with that as well when they find out that they've been working with a case where the mother is abusive, is committing medical child abuse, because obviously their job depends so much on them being able to believe the parents' health history that they're providing for the child.
Some of the primary care doctors can emerge as your worst enemy in court. And I think they insist the mother is innocent and that every medication they prescribed, every procedure they did was indicated. And I think it's because it's so hard to accept in Munchausen by proxy that you've been deceived. People feel embarrassed. And they they meant well in their interventions, but ultimately what they did might have been harmful to the child. And so they get very self-protective and argumentative in court. So that's a big challenge.
Yeah. And I think, you see that across the board. And that's why I kind of had that mention of it really can turn family members and communities against each other, because you have to go to a pretty dark place to wrap your head around it. And I think that in some cases, as Marc was saying, it might be even professional protectiveness, or really just, not wanting to imagine that you could have been deceived in this way. But, I think you also just to even wrap your head around that it happens at all, let alone that it's been happening under your nose with someone that you loved and trusted and who seems normal and oftentimes, extremely caring and loving. So I just think not everyone's able or willing to process it, even when they're confronted with extremely compelling evidence.
Mm. And what about the actual so it seems like the blast zone is a lot of the deception, right? And it's a lot of wrapping your head around how much did I believe it? What did I do in response to that lie? And, whether, we accept that it's a lie or not, and the alienation. What about the children of these, or the people who were being taken care of, right? Like the children of the mothers with Munchausen by proxy. What is the effects on the way they see themselves, or their mental health, or their...
And do they know what's going on?
They tend to be pre-verbal or early verbal. Mm-hmm. So they tend to be very young, at least when the behavior starts. And so they can't communicate their distress to anyone. And we have to be their advocates. The mother can advocate for herself. She can run to the media and to government officials and to family and friends and protest her innocence and claim it's a witch hunt. But the children may have good representation in the court system, but often don't. And so that's why we see an unfortunate number of these perpetrators regaining custody of their children, or not being criminally pursued, or just being given a slap on the wrist. In the adulthood, these children tend not to do terribly well. They may have post-traumatic stress disorder, not surprisingly. They may also view themselves as sickly when they're not. Some avoid even medically necessary doctor visits because it reminds them of the trauma, while others become Munchausen syndrome patients themselves, as if they're trying to master the trauma by making themselves sick.
Andrea, what's it like knowing you have a niece or a nephew, or both, or multiple?
I have both. Yeah, I have a niece and a nephew. Yeah. What's
it like for you to think about them, or do you have any relationship with them, or?
I do not know. So my sister actually was the one who chose to sever our relationship. Oh, okay. And so no, neither I nor my parents have seen them in 10 years. My nephew was just a little over a year old at the time, and I have never met my niece. It is unbelievably painful. And I will tell you that I fortunately have gone to a lot of therapy and have an excellent therapist. And again, it's been very cathartic and helpful for me to be able to have contact with so many experts. And, I'm hoping to sort of be able to share that experience and everything I've learned. And most days I feel like it's reasonably well managed. And then some days not so much. And when I release, you can't wake up every day and think about it, from start to finish. So you do have to compartmentalize it. Right. But it's still incredibly painful. And that's not the life I ever imagined for myself. My sister and I are close in age. I always envisioned having close relationship as an auntie, was really excited about being an auntie. I have a daughter now. She's obviously never met her, and she's not getting to grow up with cousins, and that's all incredibly painful. And I think that that's something that a lot of folks struggle with, is again, going back to that sort of grief of losing someone in that different way, where you're really grieving the life that you thought you were going to have both for yourself and with that person. And so, it's really painful. And I hope that, what I have seen that has given me some spark of hope. I mean, as Marc said, adult survivors of this, especially because our system is not good at bringing these perpetrators to justice, as he alluded to. It's really cannot overstate the very many ways that the system can fail these children, just on every level. I mean, again, the sort of general ignorance about the topic. And then, what I would love, Marc, if you could speak to this a little bit at some point, is the sort of the confusion about, is this a crime or is this a mental health issue? Is this, which of course it's both in reality, but, is this a crime that we should be prosecuting with the police and a criminal investigation? Or is this a thing that should be handled in family court where, okay, this person needs therapy? And so there's such a vast confusion about that, even in, the Lacey Spears trial, which is a really pretty famous case where she killed her son. The judge was lenient on her because he sort of believed that she had this mental health issue that was impairing her behavior. And so I think there's a lot of confusion about that in the court system. And so I think it's especially painful for survivors if their perpetrator was never held accountable. And perpetrators of this, even when they're convicted, Lacey Spears still maintains that she's innocent and she's sitting in prison. So, perpetrators rarely are willing to be accountable for their behavior, even if they are caught and prosecuted. So, you can imagine that as an adult survivor, if you have a parent who you eventually recognize, which it seems to me from talking to, Marc and some of our committee colleagues, that most survivors do eventually realize that there was abuse happening. If their parent won't be accountable, if their family is sort of gaslighting them or didn't realize, or they feel their family didn't protect them, that, the effects on all of their relationships with their family can be really difficult. But what you do see, and I have talked to some survivors who, once they came of age, were able to reconnect with family members that they were cut off from. And so that's my hope. I hope that at some day I'll be able to reconnect with them. And, part of me talking about this publicly is, I think, partly me wanting to put that kind of beacon out there for them to just say, that I didn't forget about them, and that, I'll be here.
Mm. Yeah, I can imagine how painful this is. Like what a rip in the fabric of a family, right? And without that person taking accountability, right? That seems to be kind of a theme, that person is not willing to say, "Oh, whoops, I did that. I'm sorry." Right? Right. It's everyone else has to take the brunt of it.
Right. And certainly, another pattern I've seen, which is certainly how it's played out for us, is that if you do not wholesale believe that person's version of events, then, and if you are not defending them against anyone who's accusing them of being abusive, that you are, not only are you the sort of, we agree to disagree, but no, you're the enemy. So, it's really a my way or the highway situation. So there often is no way to maintain a relationship that has any sort of middle ground where you feel like, okay, I'm going to sort of, know this behavior is going on, but still, try and maintain contact with that person so I can be there for the kids or be there for them if they decide they want help. It's just oftentimes I think it really comes to estrangement.
I do hear the similarities to borderline personality disorder with the splitting, the black and white thinking, so I can imagine how tough that is on a family level or even a social level.
Yeah. And as Marc said, I mean, it's really common to have things like borderline in the mix as well. So
I'm also glad you touched on how we have really mixed feelings about this kind of thing sometimes because it's a crime and a mental health disorder. And that's something that I think a lot of our listeners struggle with. Like, if I'm a listener and I have a loved one who is struggling with a mental disorder and I wind up getting abused somehow, do I write this off? Do I let it continue? What do I do? Because there's so much sympathy for the person with the mental health issue. Marc, when you have patients with Munchausen's or Munchausen's by proxy, are you able to have empathy for them, or what is it like to treat somebody with this?
Really, in my career, which spans 30 years, I have only had 3 Munchausen by proxy mothers admit to what they've done, and 2 did it virtually. They sent me emails confessing everything. One was from England, one was from Canada, and I think they felt safe because of the distance and anonymity, though ultimately both felt free enough to give me their real names. In both cases, I was subsequently contacted by the police in that country wanting the correspondence, which I didn't provide. Even though I didn't have a doctor-patient relationship with them, I certainly didn't have permission to share the correspondence. And I also didn't provide any treatment. I just made a referral to a local therapist. But the mothers are the ones who brought up having talked to me as if it would help to exonerate them. They said they got treatment from me, and nothing could be further from the truth. I mean, it wasn't even close. The last case was in the US, and it took her years, but she finally admitted to what she had done. And many years after that was able to regain custody of one of her children, a decision I supported and I think made sense, considering all the therapy and education she had had. And she had also been in a caregiving role with adults and done splendidly. So there were lots of indicators that she would do well. But back to the question of, is it a mental illness or is it a criminal offense? Munchausen by proxy is a form of abuse, just as sexual abuse of a child is a form of abuse. And we wouldn't say we're not going to prosecute an adult for pedophilic disorder because it's in DSM-5. The same thing is sort of true for Munchausen by proxy. It's in DSM-5 under the term factitious disorder imposed on another. But we have to refer to these people less as patients than as perpetrators, and they need to be criminally pursued.
Mm-hmm. What, for people, I mean, even just hearing all of this and how damaging it could be, it almost feels like suffocating how the negative impacts, but how little help there is on this. What can, as you were saying, Andrea, raising awareness, which I think I agree is such a great first step, but what can loved ones, family members, people do to get treatment or help themselves who either know someone or are connected to someone or I guess have it themselves?
Yeah, well, I'm so glad you asked, because actually for the last year or so, Marc and I have been collaborating on a project that hopefully will be live in about a month here. So it's called Munchausensupport.com. And we've just been really collecting kind of all of the best. Again, we're both members of this committee that has, it's an interdisciplinary committee of all these different professionals that have worked on this issue, some like Marc for many decades. And so we've been really, going through kind of all of the best practices for various professionals from medical professionals to CPS workers to guardian ad litems, and even, educators who are another, frontline professionals that can often be the first people who recognize that this abuse is happening, and just putting together, both links to sort of, media or guidelines about how to handle those cases, because various members of the committee have written about those things, and also kind of just like those bullet points of like best practices for that profession. And then there's also a section for family members, and even for, again, perpetrators. And so, sort of guide for therapists to things that those folks might be struggling with, some advice for family members for what to do. And it does depend somewhat state by state, but I mean, in general, if you have a strong suspicion that this is going on, you really should call both CPS and the police. Our law enforcement guy, Detective Mike Weber, who's worked on more of these cases than anyone in the country, and has really, literally written the book on, written the guidelines for law enforcement on this, emphasizes that you really should also contact the police in addition to CPS. They usually do talk to each other, but that's, again, that varies from state to state and district to district. And if possible, talk to that child's medical professional. So the pediatrician or whoever is treating the child, because oftentimes, obviously pediatric hospitals will have their own internal systems for handling and monitoring abuse. So yeah, I mean, hopefully kind of getting those, and that's a start. Again, that sort of really, really scratches the surface, and there needs to be more support. There aren't support groups, and there aren't a lot of resources. I'll never forget that Marc's website was the first and only thing that I found when I was looking for this information originally. And his website right now is up, and it's a great resource in and of itself. But yeah, so we're really looking to put together, and I'm hoping that we'll get this first version of the website up and then be able to really build on it as hopefully, I'm really hoping that this will bring kind of some people out of the woodwork and tell us more about their experiences and kind of get people interested in it. So certainly, more research is needed, more trainings. I think trainings are a huge piece of this. I mean, I was certainly shocked. Well, I wasn't shocked after some of the experiences I've had, but I think there is this feeling that families who are going through this often have, where they think, okay, CPS is involved, the police are involved, the hospital knows what's going on. All of these various authorities understand the situation, they're going to handle it. And then again, the many, many ways that this can sort of fall through the cracks. And then just the fact that you may have people who, from family court judges to CPS workers to law enforcement, who have never heard of it, let alone have any idea how to handle it. I mean, handling these cases is in some ways a lot like handling other child abuse cases, but there are some very specific things that, need to be kept in mind. And so it's really important for professionals who are working with children to get training. And so I think, more training is needed, more awareness is needed. And I think that's what I'm hoping for next.
I'm curious, you mentioned that there are some things to keep in mind, the difference for professionals handling these cases, a difference between other forms of child abuse versus this. Do you have one thing that comes to mind that makes it different, or something to keep in mind that you're hoping?
Yeah, I mean, I think one thing that stands out to me, and I definitely want Marc, you to weigh in on this as well. But the one thing that really stands out to me is just the deceptive nature of it is, I think, something that people need to keep an eye out for. In one of the papers I was reading about this, they compared these offenders to cult leaders. And I think the level of manipulation of those around them is really profound, and that they will often look to befriend the people who are investigating them. So they'll, befriend CPS workers and guardian ad litem. And then, of course, if they're not able to do that, then that person becomes enemy number one. And so I think really keeping that in mind. The other thing is, when it comes to, and this is just sort of top of mind because I was looking at these guidelines for CPS folks and for law enforcement, the placement while the investigation's going on and the visitation, because of the level of manipulation that goes on of the children, you have to be really careful about making sure there's a true separation test. So one of the ways that they determine whether or not this abuse is happening, and again, Mike Weber, our detective colleague, always says you really have to look at the evidence. So not just sort of trying to assess whether or not there's this particular psychological thing happening, really separating it from that and saying, is there abuse happening? Kind of yes or no. And so one of the best ways of doing that in these cases is often to separate the child from the mother and then see, do all of their medical issues miraculously resolve, which they often do. All of a sudden this child who spent, more than half their life in the hospital is walking out of their wheelchair, doesn't need this medication that they've been on their whole life, suddenly is gaining weight. If you see this spontaneous, miraculous recovery once they're away from their abuse, their suspected abuser, then that is a very strong indication that this abuse is taking place. But if there isn't a true separation test, if they're still in the house with that parent, if they're staying with relatives who don't believe the abuse is happening or don't understand what to do, if that parent is still able to really influence the people who are taking care of the child, who are, if they're talking to them on the phone all the time, if they're they can coach the child oftentimes. And so, it's really like those kind of things can really mess up the ability to determine whether or not abuse is taking place. So obviously you want professionals to know that from the minute that these investigations start. So that's the one that really sticks out to me, is the placement issue.
Okay. Well, first, I just want to see if there's anything that we should have asked. Like, is there anything kind of top of mind that you think about this disorder that you want people to know that we haven't known to ask?
Well, we've talked about the isolation, the friends and family experience. My website is called Munchausen.com. Mm-hmm. And I've had it up since 1996 with people having the opportunity to email me through the site, and that persists to this day. I get hundreds of emails, and almost all of them are about Munchausen by proxy. And each person I talk to is so relieved to know they're not the only one, and that there is a name for this. There are resources out there, and it gives them a ray of hope that they may never have felt as soon as they became aware that a child was being victimized.
Okay, well, shall we wrap up with some?
Yeah.
So we've given you all resources. By the way, I think you've said the website is maybe not complete or being developed.
Well, so Marc's website that he mentioned, Munchausen.com, has a lot of great resources in and of itself. This one was sort of put together. The one that we're collaborating will be Munchausensupport.com, and that is going to be specifically aimed at, helping those various groups of people that I mentioned.
Okay, so
my site mentions it covers Munchausen syndrome, malingering, factitious disorder imposed on self, and Munchausen by proxy. But I would say it's especially heavy on Munchausen by proxy because of the extent of the questions I get.
Okay, perfect. So we like to end by providing resources. So very, very grateful that, Marc, that you have this wonderful website with so many resources. So we'll post both websites. Andrea, your books, Marc, your book, and thank you two so much for joining us. I'm serious when I say that this could have gone on for another hour or two, just covering these topics. And I hope there's somebody out here who feels less alone from listening to you. And I'm glad you're doing this work, and I know how painful it must be for you too, Andrea. So,
well, thank you guys for your interest in the topic and for asking us such good questions. And I want to say too that, again, I'm not an expert or a doctor as Marc is, that I am happy to hear from people who also just have had a similar experience and want to talk to someone who's been through it. So, feel free to reach out to me as well.
How can they reach out to you?
Via my website or via Instagram, where I am very active.
Okay. And what's your handle?
Just at Andrea Dunlop.
Okay, cool. All right. Thank you two so much.
Thank you. This is wonderful.
Thank you, guys.
By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.